Good morning, good evening, good night, all of you. Can you hear me? Can anybody hear me?
Yes, sir.
Okay, thank you. So, yesterday we have discussed some reading tips, and today we will continue reading, and tomorrow we will do writing and
Yes.
possibly writing and reading. Just let me check. Okay, so reading. Anybody can repeat me what we need to do when we start our reading part A question? Just quickly, please. Okay, can you see my screen?
Yes, sir.
Okay. So can anybody just tell me what we need to do when we start our reading part A question?
ഇല്ല ഇല്ല പക്ഷെ ക്ലാസ് തുടങ്ങി
Please,
ക്ലാസ്
can you hear me?
ക്ലാസ് അതെ
Please,
ഇടയ്ക്ക്
please mute if you want to talk something personal, mute.
So while we are studying part A, we need to find
So
out
what we need to do? Yes, please.
some clue words or help words like
Yes, what we call this skimming and scanning.
skimming and scanning. Yes.
So we need to do skimming and scanning. What else? How we do skimming and how much time we should spend on doing skimming and scanning?
1 minute.
1 to 2 minutes. Okay, almost. There is no fixed rule, but mostly 1 to 2 minutes would be enough.
Yes.
And how we will do skimming and scanning? How we will do skimming and scanning?
mark the headline,
Yes, please.
mark the headlines,
Okay. Mark the headlines. What else? What else?
some important headlines like signs and symptoms, definition,
Uh-huh. Okay, that is good. Headings, subheadings, these things. Okay.
subheadings, yeah.
Yeah. What
Then
else?
some names, and some
Okay.
numbers,
Names, numbers, dates. Okay.
dates,
Headings, subheadings. Okay. First line of each paragraph or mostly is important. You can just quickly skim through the main line. Okay. What else? Okay. So just 1 minute. We will start now. Just waiting for others to join. Okay, people on Facebook, I can see your comments also. So you can ask anything if you wish. Okay. Okay. So we have today Johnson B. Dharamdan, HPC, Samanthika, and Stara. Okay. Just can you mention in the chat you are doctor or nurse? Okay, just quickly, please. You are doctor or a nurse? Are you a doctor or a nurse? People on Facebook, you can also mention. Okay. So I can see nurse, nurse, nurse. Okay. Okay, no problem. Your reading is both for doctors and nurses. So who will participate now? So just if you remember, we have done skimming and scanning yesterday quickly. Okay, so there are 12 people on 14 people on Facebook also. Okay, doctor and nurses. So this is mix, okay. So if you remember in reading part A, we need to do skimming and scanning, and here is the topic is omeprazole. So if you remember, this is a medication, okay. Omeprazole is a medication. So that skimming and scanning that we have done yesterday in reading part A in text A, mostly they're talking about physiology, okay, means how the acid reflux, okay, is and how omeprazole works, okay. Acid is produced naturally in the stomach, and acid is irritant, and there is ulcer. People can have problem with muscular band, so this is referred as acid reflux. So they are talking about acid reflux, okay. What is acid reflux? Okay, and how acidity is produced. And okay, so next they are talking about how proton pump inhibitors PPI or omeprazole works to reduce your acidity. Okay, and then omeprazole available on prescription, and you can buy short course at pharmacy, and when you want to relieve your symptoms. Okay, so this is text A quickly. Maybe some of you are new today, so that is why I'm doing just quick skimming. And in text B, if you remember, there was algorithm. This algorithm is about the treatment, okay? Diagnosis and treatment, okay? How we diagnose GERD and acid reflux or GERD, and how we treat acid reflux or GERD, okay? If you can share this session with other doctors and nurses, that would be great, okay? If you can share this session with other doctors and nurses, that would be great, okay? Thank you. Okay, so here you can see we have PPI when we use once daily, and what happens, okay, next when we use twice daily. If there is success, there is no success, what we need to do, okay. So this is the algorithm of treatment, okay. And if the symptoms are negative, then what what we need to do. If there is a heartburn after the treatment, empirical therapy, what we do, okay. Just see the pain modulators review again, bedtime anti-reflux surgery, pain modulator. So these are just quick skimming and scanning, okay. Then we have in part C, in reading part C, we have caution. So here you can see cautions. So here we have bullet points, and we are talking about precautions, okay, precautions or cautions. So first, PPI association with Clostridium difficile associated diarrhea, okay, association with diarrhea. Then we have association with liver disease. Then we have association with lupus erythematosus disease. Then we have association with gastric carcinoid tumors. Then magnesium deficiency. Then we have clopidogrel. Clopidogrel, okay. Okay, then we have interstitial nephritis, we have gastric malignancy, we have here proton pump inhibitors with relation with methotrexate. Okay, so when you are reading part A, just you can quickly come back and you can skim and scan. Okay, you can just read in which bullet point you can find the answer. Then we have uh, text D. Can anybody tell me what is in the text D? Just quickly, please. Text D. In text D.
PPI is linked with the benign polyps, fundy glands,
Okay,
and
and when we use, the main thing is long-term use,
yes,
and within the long-term use is, uh, association with benign polyps, and then we have association with dementia here in the next paragraph. In the next paragraph, there is a review article and the association with calcium absorption. Okay, then we have relation with pregnancy and breastfeeding. Okay,
yes.
so here you can see a pregnant breastfeeding woman, epidemiologically data does not show increased risk of major defects, and no clinical trials have developed evaluation positive consequences of this. Has a high plasma bonding, okay, and muplas needs to be administered in entire coating formulation. And okay, so this is just quick skimming and scanning. You will do this quick skimming and scanning in almost 1 to 2 minutes. Okay, okay. So after that you will come to the questions. Okay, as I already told you yesterday, some people like to do start from question number 1 till question number 7, and some people they start from question number 8. Please mute. Okay, please mute. When you want to participate, then you can unmute, otherwise please. Okay, so we have done how many questions yesterday?
We had done 7 or 8 questions, I think so.
Okay, so yesterday we have done almost 10 questions, I think so. 7, 8, 9 questions. Okay,
9
2 from fill in the blanks, and we have done 7 from this part. Okay, so now we will go to question number 10. I have just given overview so that if there is any new student, they can get an idea. Okay, can anybody read question number 10, please? Just quickly, question number 10. Sorry, question number 10.
To save it from the negative effects of acid produced by stomach, the omeprazole should be given to the patient in.
Okay, so what do you think? Please write in the chat, those who are in Facebook or those who are in live class, please write in the chat what is the possible answer. Means in which text you can find the answer. Question number 10. In which text you can find the answer. Please write in the chat. Please write in the chat in which text you can find the answer. In which text? A, B, C, or D? So people are saying in text A. Okay. So let us go to Miss Nirmala. Can you hear me? Or Dr. Nirmala?
Yes, sir.
Okay. So you will try to find the answer. You will not tell us the answer. Just you will tell that.
Yes,
Got it. Okay. When you find the answer, just tell me got it. Okay. This is the text. This is the question. Other people can write in the chat anything that you want to discuss. You can write in the chat, or if you find the answer, you can write got it.
I got it, sir.
Okay, just write in the chat what is the answer, because this is not just in which text you can find the answer. This is fill in the blank. Okay, can you write in the chat of Zoom or chat on Facebook what is your answer? Please write in the chat what is your answer. Okay, I got two answers. Yeah, this is text A, but what is the exact answer? Because you have to give. This is just fill in the blank. This is not what you can, where you can find the answer in which text. No, you have to fill in the blank. Okay, fill in the blank. Okay, what is your answer? Fill in the blank. Okay, low ceramics. What is your answer? Please write in the chat. What is your answer? What is your answer? Okay, can anybody talk with me? What is the answer? The lining? Okay. Can anybody unmute and talk with me?
Sir,
Yes. Yes, please.
yeah, I got it in the second paragraph and first line,
Uh-huh.
but I'm not sure. I couldn't stuff in the line of the stomach for producing too much acid.
Okay. Where is the answer? Where is
Second
the answer?
first line,
Last
stuff
line in second paragraph?
first line.
First line.
Yeah.
Omeprazole stops the cell lining of the stomach from producing too much acid. Okay. This helps prevent ulcer from forming. To save it from negative effects of acid produced by stomach, omeprazole should be given to the patient in treatment. No. All second line. No. This is the wrong answer. Okay, your answer is not in text A. Okay, you are at the wrong place. Just imagine if you are in the real exam, you are at wrong place and you spend a lot of time in finding the answer here at the wrong place. You will waste your time. Okay, do you think the answer is text C or not? No, the answer is not in text C. Okay, try to find the answer here in text D, please. Sorry. Try to find the answer here in text D, please. You are just write in the chat. when you get the answer. Write in the chat when you get the answer. Okay. Can you find the answer?
Yes, sir.
Very good. Excellent. Okay. So what is the answer? What is the answer?
Enteric coated.
Very good. Very good. Okay. So your answer is here. What needs to be administered in enteric coating formulation? So this is your answer. In an enteric coating formulation, this is your answer. Due to its rapid degradation in the acidic conditions of the stomach, to suggest that most of the foreign molecules ingested by the infant are likely degraded before being absorbed. Okay. Yeah. Okay. Needs to be administered in enteric coating formulation due to its rapid degradation in the acidic conditions of the stomach. Okay. So if I'm saying that it should be given in enteric coating formulation because it degrades rapidly when there is acid in the stomach. So to save it from negative effects of acid means by degradation of the acid. So I'm not using the exact language that is given in the bullet point. If I use that, then everybody will answer correct. Okay, everybody will give correct answer, and there would be no way to differentiate between well prepared and other students. Okay, so I have changed the language. Okay, due to its rapid degradation in the acidic conditions of stomach. Okay, so to save it from negative effect, what is the negative effect of acid? Omeprazole degrades rapidly. To avoid from this effect, omeprazole should be given to the patient in an enteric coating. And number one, I have used synonyms. Okay, okay, similar language, but I have changed the language. Number two, anybody can tell me what else I have done? Can you see the order of information? Can you see the order of information? Can you see the order of information? Can anybody talk with me? No? Can anybody talk with me, please? No?
So, have you used a passive voice in first part of the question?
Yeah, that is one thing. But if you see, omeprazole should be given entire coating. This is first part of the sentence. In second part, this is negative effect of acid. So I have changed the information. The last information I have taken it at the start, and the first information that is given in the text, I have taken it at the end.
Okay.
Here at first is omeprazole should be given entire coating, but in my sentence, this is the same. This is synonym. Synonym you can say that's paraphrasing. Okay, this is paraphrasing of this sentence. Okay, so the first part I have taken it at the last. Okay, I have paraphrased it, the text, complete text, but I have changed the order also. Okay, omeprazole should be given to the patients in an entire coating formulation that was given at the start. Okay, at the end it was given to save it from negative effects of stomach. Okay, so there are two things. Number one is paraphrasing and number two is order of information, okay, in the sentence. Anybody has any question about this question? Question number 10?
No, sir.
No, okay. So now let us move to next question. So deficiency of dash can cause fits in patients due to longer use of omeprazole. There is something missing. Deficiency of something can cause fits in patients due to long-term use of omeprazole. Do you think I will give the same word fits in the text?
No.
What are the synonyms for fits? Can you write in the chat, please? What are the synonyms of fits? Very good. Seizures, convulsions. Very good. Jerky movements. Okay. Now tell me in which text it is possible to find the answer. In which text?
It's
In
in the caution.
epilepsy is also possible. In the cautions?
Yeah.
Okay, in part C, in text C, okay. When you find the answer, just write in the chat, got it, okay. Don't tell me the answer. Okay. Write in the chat, got it, okay. When you find the answer, just tell me, got it, okay. Here is your question at the end, and here is the reading part C. Deficiency of something can cause fits in patients due to longer use of omeprazole. Just write in the chat, please, okay. Okay, write in the chat, what is your answer? Okay, someone got it. Write in the chat, what is your answer? This is fill in the blank, okay. What is your answer? Deficiency of something can cause fits. Very good. On Facebook, I can find Umetaha. Very good. Very good. Magnesium. Yeah. Please mute. Okay. Mohammed Shafi, please mute. Okay. So deficiency of magnesium can cause fits in patients due to longer use of omeprazole. Okay. Very good. So the answer is here. So instead of prolonged, what I'm using? Prolonged use, longer use. Okay.
Yes.
Deficiency, magnesium deficiency. I'm saying deficiency of something can cause fits. So here is fits, here is seizures. Okay. So what you need to keep in mind is when first you need to think in which text it is possible to find the answer. In which text. Okay. So once you reach that text, then try to find the exact answer. Okay. Next question. And just keep in mind that the author or the examiner can use synonyms, can use paraphrasing. Okay. They can change the order of information. Okay. So all of these things can happen and you need to be very quick in finding the answer because you will have only 15 minutes. 15 minutes, okay? The next question is a defect in what at the upper level of stomach can cause heartburn, okay? Just write in the chat In which text you can find the answer? A defect in what at the upper level of stomach can cause heartburn? Just write in the chat, please, where you can find the answer. In which text you can find the answer? Just quickly, please, write in the chat. Write in the chat in which text you can find the answer, please. In which text you can find the answer? Very good. Text A. Text A. So let us copy and let us go to text A and let us try to find the answer. Here's your text A. And here is the question. Please try to find the answer and write in the chat. Try to find the answer and write in the chat, please. Okay. What is your answer? This is fill in the blank and you should write exact answer. Okay. Please find the exact answer. People on Facebook, you can also try to participate actively. Okay, write in the chat what is your answer, exact answer. So one answer I got so far is second para first line. Okay. Just write the exact answer, please. Okay. Exact answer. Write the exact answer, please. So we have two answers so far. Number one is stomach lining and number two is muscular band. So who have given the answer? Acid reflux is also given. Three answers: muscular band, acid reflux, and number three is stomach lining. So those who have given the answer stomach lining, please, can you talk with me, please? Or acid reflux? Mohammed Shafi or the Ramadan? Can you talk with me, please? Any of you? Or anyone else? Anyone else?
Yes, sir.
Yes, please. What is your answer?
My answer is stomach band, muscular band.
Muscular band. Okay. So why?
Because
What are your
there is
keywords? What are your
upper
keywords?
level of stomach mentioned here.
Upper
Top
level. Okay. Upper level of stomach. Okay.
yeah, top
And
of
number two, what else?
and cause and
No, that is not key.
defect.
Defect. Okay. Defect. Okay. These are two
Yeah,
keywords.
yeah,
These are two keywords here.
yeah.
Defect and upper level of stomach. Where you can find these keywords?
Yeah, top of the stomach mentioned here.
In this sentence.
Yes, yes,
In this sentence. Yes.
yes.
Now you have matched your keywords and now you need to find the exact answer. For that, you need to read the complete sentence. Okay. Other people can have a problem problem. So instead of problem, what I'm using?
Defect.
Defects. Can you see I'm using synonyms? Paraphrasing.
Damage.
Okay. Yeah. A defect in what? Okay. A defect in what? At the upper level. So at the top of stomach, at the upper level of stomach, causes heartburn. Okay. Even in this sentence, heartburn is not written. Okay. But if you continue, this allows the acid to escape and irritate the esophagus, causing heartburn. So this, the word this may allow. What is this refers back to? This refers back to what?
Defect.
Defect in muscular band of, okay, top of stomach. Okay, this. So refers back to that. That is why I have taken the heartburn here. So my answer would be a defect in what at the upper level stomach causes heartburn? A defect in muscular band. Okay, so the answer is muscular band. Very good. Okay, very good. Excellent. Okay. Okay. Reading part is not difficult. Just this is time of time. It is game of time management. Okay, how you manage your time and how you quickly you can find the answer. Okay, quickly, and you need to find the correct answers. Okay. By taking omeprazole, the chances of dash might exist even if symptoms are relieved by its use. In which text it is possible? In which text it is possible to find the answer? In which text is possible to find the answer? In which text is possible to find the answer? In which text you can find the answer to this question? By taking omeprazole, the chances of dash might exist even if symptoms are relieved by its use. A or B? Someone is saying C. Anyone else?
Sir, in B.
In B, okay. I got some C options also, A or B also. Let us see what people say on Facebook. Okay.
Sir,
A,
just
B,
show
or
the
C. Yes, please. So in which text you want me to show which text? A, B, C, or D? So that you can find the answer.
sir,
Maybe
D
there is
text.
no answer. And B, okay. B, I have to make it small.
Sir, D text, please.
Yes, so here I think you can see all the things. Question and algorithm also.
association. I leave it empty.
All of you can just
Mention
try.
it.
सर इसमें तो नजर नहीं आ रहा कुछ भी इधर भी देख सकते हैं
Are you not able to see, or the text is small? Or you cannot find the answer?
here I can't see the text. Please show. So there is some table which is
Yeah, there is table. I am showing you table. Can you see that?
yes sir, but there is not that table.
You cannot find the
Like
answer in table.
Yeah, I think A.
Okay, it means the
yes,
answer is not in text B. Where else we should go?
Yeah,
A or C or D?
A, sir.
A?
sir.
Yeah,
Okay. I think the answer is not in A.
okay, C.
Material cells.
Answer is not in A, not in A, not in B. Okay.
Yeah,
Yeah, material cells.
Can you see how you will waste your time in the real exam? Okay, just we need to be very quick. You will find some very easy question. Even this question is not difficult, but the examiner have made it so vague that you will try to find in different texts. You will waste your time because you have only 15 minutes for 20 questions. And one first minute and last 1 minute, in these 2 minutes, you will not be able to do anything because you will be under exam pressure, okay, in the last minute and the first minute, okay. Then you have only 13 minutes to answer 20 questions, okay. Let us go to text C.
Gastric carcinoma. Tumor.
Are you able to find the answer
no, sir.
in text C? Then where we should go? Our last hope is text D, yes or not?
Yes, sir.
Okay.
Long term
The answer was in text C, I think.
In text C.
आप
Waiting
दौड़
result,
ना
the chance, please mute. Okay. The chances of dash might exist even if symptoms are related by its use. Okay. Just let me see.
Dementia.
No. There is possible
Gas
association.
gastric cancers or others serious gastric problems.
Yes, that could be the answer. But taking what is the chances of gastric cancers or other serious gastric problems might exist even if symptoms are relieved by its use.
There is no mention regarding
Yes.
symptoms are relieved over there.
Okay, let us see here. Maybe this is a little bit vague question. No association seen between PPI use and cancer, but use of PPI may mask gastric cancer or other serious gastric problems, and physicians should be aware of that. Maybe just a little bit vague question. I should reconsider it. Okay, I will see it again.
Because the
It should be a little bit more clear. Okay, yeah,
okay.
and the real exam they've not make things vague. Okay, I will see it. Okay?
Oh,
Yeah, I will try to find the exact answer. If not, I will change the question. Okay? Which type of medication should be given to a patient whose heartburn is incompletely relieved by H2RA? In which text is possible to find the answer? In
text
which
B.
text? Text B, yes. So here is text B. I will try to paste here so that you can see the question also. You can see question, you can see almost half of the text, almost complete text. Okay.
Pain modulators.
What are your keywords? What are your keywords?
H2RA.
H2RA. What else?
Incompletely.
Incomplete relief. Okay. Yes. Okay. Then which type of medication?
Yes.
Yes. These are three keywords. So what should be your answer? Please write in the chat. What is your answer? Write in the chat. What is your answer? What is your answer?
Pain modulators.
Pain modulators. Very good. Excellent. So here you can see I'm asking which type of medication. I'm not asking exact the medication. The type of medication means the family of medication. Okay. Class of medication. So here your keyword is H2RA. You can see here TLESR. Here you can see H2RA again here. Okay. H2RA again here. You cannot see H2RA anywhere else. Okay. So here is, where is the word incomplete here? Failure. This failure mean here in the
Incomplete.
footprint. Okay. Partial or incomplete relief of symptoms. Okay. So which type of medication we should give? Pain modulators, okay? Pain modulators if after use of H2RA still there are symptoms, okay? So there is partial relief of symptoms. Very good, okay, excellent.
H2RA is already another mentioned over there, but the
This is the answer is there in the end, yes.
yes.
Okay, good, good. So question number 18 is not like 18, is just we have changed these three, they are counting as, when we have copied here, they are counting as Okay. Question number 15. According to statistics, if a pregnant woman takes omeprazole, there is no change in something. Where it is possible to find the answer in which text? In which text is possible to find the answer?
Taxi.
Taxi?
Text
In which text they're talking about the pregnant woman?
D. D.
In D. Very good. Excellent. Okay. Go to text D. In text D, we have two parts. Number one, long-term use. Number two is pregnancy and breastfeeding. Okay. Try to find the answer in pregnancy and breastfeeding. Try to find the answer. Write in the chat what is your answer, please, quickly.
तो ये पूरा प्यारा नहीं शो हो रहा है, इसको क्लियर से थोड़ा साइड पे करेंगे प्लीज।
Now you can see.
बट स्टिल ये हाफ नजर आ रहा है।
Breastfeeding.
Your answer is here in this paragraph.
ओके सर, द सेफ्टी ऑफ द यूजिंग omeprazole has not been.
If your answer is not here, then I will show rest of the part of text D.
I think so, it's breastfeeding.
Birth defects.
Feeding,
Breastfeeding.
Yes, sir.
I think so.
Let me show you complete text D. I think now you can see the complete text D. Just let us rule out first in first part, okay? Long-term use, if we can find the answer there or not. Please mute, please mute. Please mute. Answer is not in long-term use. Answer is here in this text and try to find the exact answer, please, okay? We have two answers. Number one is breastfeeding and number two is major defects of birth, okay? We have two answers. Try to find the exact answer, please. Okay?
So breastfeeding is exact answer.
Okay, so finally, what is the answer? Breastfeeding or major birth defects? What is the answer? What is the answer? What is the answer? Do you want me to help if you are not able to find the answer?
Major body defect.
Yeah, yes, sir, we need your
Where?
help.
Yes, sir. Because
Where?
means the pregnancy, I think so.
Okay, so you have two options. Number one is major birth defects, okay? And number two is breastfeeding, okay?
Yeah.
Because your word statistics is in two, okay, places, okay? So you have two keywords, statistics here, okay? If a person takes omeprazole, okay, this is not any big thing. There is no change in something, okay? No change in something, okay?
Okay.
So you have two keywords. Clinical trials, you can say statistics, but mostly epidemiology data is statistics, okay? You can use synonym instead of epidemiological data, you can use statistics, okay? This is synonym of epidemiological data, okay? Even if you don't know this, you can still answer, okay? With the help of second keyword, no change in, okay? If you see this word, this does not show an increased risk of. Can you use no change? Can you use no change instead of this? Does not show an increased risk of. Can you say no change? If something does not increase, you can say no change. Yes or not? Whenever you do reading from any sample, you need to critically analyze everything. Otherwise, you will be doing a lot of reading samples. At the end, your score will remain same. Okay, and many doctors and nurses keep failing reading part again and again. Okay, Dr. Pulvasha is very active on Facebook. Thank you so much. Very good, excellent. So, okay, no change does not show an increased risk of something. Okay, after maternal use of, instead of maternal, what I'm using?
Pregnant woman.
Pregnant woman. Okay, maternal use. Okay, during pregnancy. Okay, even I'm just using pregnant woman instead of all of this text. Maternal use of during pregnancy. Okay, pregnant woman. Can you see this? Can you see pregnant woman can breastfeed? Pregnant woman can breastfeed or not?
No.
No, sir.
No, okay, no. Okay. So okay. So a pregnant woman takes omeprazole, there is no change in. What should be the answer? Breastfeeding or major birth defects?
Major birth defects.
The answer is major birth defects. Is there anything no clinical trials have deeply evaluated the consequence of use of breastfeeding? I am saying here in this sentence, there is no clinical trial that have evaluated what effect is of omeprazole on breastfeeding. I am not saying there is change or not. I am saying there is no study that has evaluated omeprazole effect in breastfeeding. However, pharmacokinetics, statistics no, pharmacokinetics strongly suggest the safety of omeprazole during breastfeeding. This is pharmacokinetics, this is not statistics. That show safety, and they are not saying no change, they are showing safety. Is there anyone still in doubt for the answer? Anyone still in doubt?
No, sir.
So what is the answer?
Major birth defects.
This is how you will waste your time in the real exam, because you will have some points which are similar, and you have to pick the correct answer, and that is becomes a little bit difficult. The main thing is you will spend some time here, and at the end you will not be able to complete your 20 questions. Okay. Okay. Efficacy of which medication can be decreased due to use of PPI? Efficacy of which medication? No. In which text is possible? In C or D. Okay. Let's try to find here. I will help you because you are tired.
Clopidogrel.
Okay, you can find answer in C or D. In both is possible. I was thinking it could be in D, but someone is saying in C.
C.
Okay, let us first try to find here. If answer is not here, we will go up. Okay.
C last line, sir. What?
Methotrexate.
Clopidogrel.
Okay. First, find here if you can find something here or not. Just in text D. Okay. I think no. And answer is not in D. Okay. They're not talking about decrease in efficacy of any medication. Okay. So no. Let us go to text C. Okay. So this is complete text C. Okay. Try to find the answer here.
6 bullets, sir.
6. Okay. Number 1, 2, 3, 4, 5, 6. PPI may decrease the efficacy of globulin by reducing formation of. Very good. This was easy question. Okay. But I will waste my time. First, I will go to D. Then I will come back to C. Okay. Very good. The answer is clopidogrel because you can match all of your keywords here. And the medication is clopidogrel. Okay. This is the medication, name of a medication. Very good. Okay. Next question. Okay. What should be done if a patient experiences red flag symptoms after taking PPI for 8 weeks?
It's
In
in
which
caution.
text is able to find answer?
It's in cautions.
C.
In C. Okay.
Oh.
What are your keywords?
8 weeks.
What else?
PPI.
Red
Red
flag.
flag symptoms. Okay. Try to find the answer here. Try to match your keywords. Just quickly try to find the keywords. Otherwise, you will waste your lot of time. Okay. Are you able to find the answer keywords here in text C?
No, sir.
Someone has given answer SLE, systemic lupus disease. And that is in which bullet point? This bullet point, yes? No? No, in this bullet point. Is there any mention of 8 weeks or 1 month? Instead of 8 weeks, what else I can use instead of 8 weeks?
Less than a year.
No, 8 weeks, 2 months, okay? 4 weeks is 1 month, 8 weeks is 2 months. Is there anything similar in this text? I think no, you are wasting, we are wasting our time, okay?
Here and not here.
SLE, no, we are wasting. In which text we should go now? Text answer is not in text C.
B, sir.
B, very good.
2 months.
Let me copy the question here. Try to find your keywords, okay? Try to find the keyword. This is an interesting question. Write your answer in the chat. Write your answer in the chat, please. Write your answer in the chat.
What should be the one location?
Yes, please.
Upper endoscopy, sir.
Write in the chat, please. Interesting question. At how many places 2 months is given or 8 weeks? At how many places? Here 2 months and here is given 2 months, okay? So you can find your one keyword at 2 places. 2 months here, 2 months here, okay? Yes or not?
Yes.
Okay. Now you need to find other keyword that is
Alarm.
red flag symptoms,
Red
okay?
flag. That is mentioned in alarm symptoms.
That is mentioned here, alarm symptoms. This is synonym, okay? Is there anything alarm symptoms or red flag symptoms here? Esophageal failure, no
No.
access to esophageal impedance empirical therapy, no. So here is alarm symptoms. If there are alarm symptoms after you have taken PPI for 2 months or 8 weeks, what we should do?
Upper endoscopy.
Upper endoscopy, very good, okay? But when you're in the real exam, you will spend a lot of time to find this answer. This is the time to prepare yourself. When you see any reading material, try to do things like this, okay? Serum concentration of which medication can be increased if it is given with PPI? Can be increased or should be increased, can be. In which text is possible to find the answer? In which text? It could be in C or D, okay?
C.
Let us first try and see, okay? Just quickly skim and scan, okay? Find some medication. Okay, then a serum concentration. Don't give answer, write in the chat. If you find the answer, write in the chat. Write in the chat what is your answer. Quickly, please. On Facebook, someone is very active. Pulwasha Hamid, very good, excellent. Okay, very good. People on Zoom also are very active. What is the answer? Someone can talk with me.
Yes, sir. Methotrexate.
Methotrexate. Okay, what are your keywords?
Serum concentration.
Serum concentration of some medication. Okay, and
Can
increase. Okay, increase. Okay,
increase. Yes.
increase the serum concentration of some medication. Okay, when we give it the PPI. Okay, so may elevate or prolong serum concentration of methotrexate or its metabolite. Okay, so why you are not saying metabolite?
It's a process metabolite. Actually.
Yes, I'm asking medication. Of which medication? Okay, of which medication? Okay, so if I say serum concentration of what can be increased if given with PPI, what you will write? I'm not, if I don't say medication, this is a very
Metabolites.
important thing. Okay, this is a very important thing. If I say serum concentration of what can be increased if given with PPI, what will be your answer? Then your answer should be methotrexate and or its metabolite. Okay,
Okay. Yes. Yes.
then your answer should be this complete.
Both.
Okay, both. No, in the question, why I'm saying, because this is not too difficult. Reading part is not too difficult. It is little bit time consuming or difficult to find the answers, but answers are not too difficult. Okay, so I will not make it too difficult for you. So serum concentration of which medication? So out of these two things, medication is only methotrexate. Its metabolite is not a medication. Okay. Very good. So next, which medical condition can be disguised if PPI are given for a long time? In which text it is possible to find the answer?
D.
Just write ND. Okay. ND. Okay. You will not give me answer. You will write in the chat. Okay. Write in the chat what is your answer. Quickly, please. Just we have only one question. One more question, then we will end the class. And we have writing and speaking feedback, individual feedback classes. If anyone or any of your friends who are preparing for OET wants to take is individual feedback with me, okay, only. We don't have any other teachers because I only trust myself because I provide quality feedback. I have been teaching OET since 2020. Okay, what is the answer? Which medical condition can be discussed if PPI is given for a long time? Just in the chat, please. Don't give me answer. Write in the chat. Okay. Very good. Benign polyps. Very good. Benign polyps. Very good. Is interesting question, by the way. Dr. Pulvasha, Hamid, I am waiting for your answer. Just reconsider it, Dr. Pulvasha. Reconsider your answer. Reconsider, please. Match the synonyms, match the keywords. You will find your answer somewhere else. The answer is not benign polyps. Answer is not benign polyps.
Osteoporosis and fracture.
No. People, what are your keywords? Can someone tell me what are your keywords? Dr. Pulvasha, please reconsider your answer on Facebook.
Disguised.
Disguise, okay.
Fundic gland polyps, actually.
Critical condition.
Can you, okay, can you find just synonym of disguise in this text? Just in this text, find the synonym of disguise. Just
Distinct.
try to find, please just write in the chat, okay.
Okay.
What is the synonym? Try to find the synonym. This is the trick that the examiner uses to evaluate you, okay, in the real exam. Disguise. If you don't know the synonym of disguise, you will give a wrong answer. Okay, now let me give you a little bit hint. Disguise is, what should I say? If there is a male and he comes in front of you in a female clothes, okay, in female clothes, in female attire, okay, with hijab and with everything like females. So this male is disguising himself as a female, okay. Now try to find the answer in the text. Okay,
Sir, hypothesized.
what?
Hypothesized.
No. Okay. Can you see the word can be? Can be and disguised. Try to find the answer in this sentence. I know I have given you the sentence. This sentence. Your answer is in this sentence. Yeah, very good. Okay. Samantika, Dharampala, are you a doctor or a nurse?
No, sir.
Nurse, one free writing correction for you.
Okay.
One free writing correction for you. After the class, you can text me on my WhatsApp. I will give you case notes and one free correction for you, okay? Because you are given
Okay,
the
sir.
correct answer. So you people can see no association is seen between PPI use and cancer. This is something no association is seen, okay? No, when I'm using but, it means something opposite is coming. If I say like this, you cannot pass OET reading module, okay? Or say students cannot, or nurses cannot pass OET reading, comma, but genius nurses can pass, okay? It means there is something different is coming after but, okay? But use of PPI may may disguise gastric cancers, other serious gastric problems, and physicians should be aware of this effect. Okay, like this. If patient is coming with, epigastric pain, we mostly keep thinking this is just ulcer, this is just reflux, okay? And we keep giving PPI for a long time. And their symptoms are relieved by use of PPI, but we don't reach to the bottom of the problem, that is cancer, that is behind that. Their symptoms are relieved, we are not. So PPI can mask, can disguise, okay, can hide, even I can say can hide symptoms of which medical condition, gastric cancer. You can say other gastric problems because this is not a medical condition, so you will say gastric cancers, okay? Which medical condition can be distinguished, can be disguised if PPI are given for a long time, so you will say gastric cancer, okay? I think is an interesting question, yes or not?
Yes, sir.
Interesting question or not? Okay. So if
Yes.
you people are enjoying and you think that you are learning something, you know, when you when something is when you want to learn something, you should be a little bit, what I should say, patient. You should wait, you should learn something, okay? There some people, they give very short tips and tricks and you should do this, you should do that. That is not possible for reading module, okay? So you need to prepare yourself very well, okay? So the last question, so what I want to say is, please, for the next free classes, try to invite your friends who are taking OET, okay? Try to invite your friends for the free class. Okay. So adherence to PPI and their dash should be reviewed if a patient tests are positive for acid reflux, okay? In which text you should find the answer? Just quickly, please.
B.
In which text?
B.
Adherence to PPI and their dash should be reviewed if patient's tests are positive for acid reflux. Okay, let's go to B. Someone else told we should go for B. Let us copy the question here. Okay. So what are your keywords?
Positive for acid reflux.
Okay. Adherence to something. Okay. And their PPI and their something. And if tests are positive, you need to find where are tests, okay? And the similar other words. Write in the chat if you find the answer. Write in the chat if you find the answer. Write in the chat if you find the answer. What is your answer? Please don't give the details. Don't explain something in the chat. Just write your answer. What is your answer? Okay, can anyone talk with me? What is your answer? What is your answer?
Dosing time and
Just
compliance.
Time.
okay. So if you give the answer compliance, it is wrong, okay? And if you give answer dosing time and compliance, it is also wrong.
Okay.
What is synonym of compliance?
Adherence.
So I have already given you synonym of compliance, that is adherence. If you give me here the answer dosing time and compliance, then your answer is wrong because you don't know. Your English is weak. You don't know the synonym of adherence and compliance. Even this is medical term. If the patient is not compliant, not adherent to their medication, they can get issues. Okay, this is a medical thing. You should know that. So if you don't know, if you write your answer dosing time and compliance here, it means your English is weak. You don't know synonym of compliance. So I have already given you adherence, compliance, adherence here to PPI. PPI is given here and their dosing time. So I am changing the order of information also. These are things to judge our students, okay? To test you, okay? Adherence to PPI and their dosing time, adherence and their dosing time should be reviewed if patients' tests are positive. So here you can see these are tests. This test plus pH. These if these are positive, okay, these are positive for acid reflux. These tests are positive. Then we should review as given here. If review is not given here, the word review is given here. So we need to review dosing time and compliance. So your answer is dosing time. Okay. Was interesting or not?
Yes.
Is interesting, yeah. So why doctors and nurses they keep failing reading module again and again? Why? Why? Because they don't focus on improving their English. They just keep doing a lot of reading samples, and they don't focus on their mistakes and improving their English by uh, you know just doing critical analysis of their mistakes. Okay, so please try to improve and try to. So who will invite their friends for next free class? Because you can see if the people keep decreasing, I will stop classes because I am a doctor. So if there is no response from my students, so I will not take free classes. Okay. So who will invite their friends for next free class?
Sir, I will invite 2, 3 friends.
Okay, just please invite your friends so that we can continue these free classes. And even these samples you will not find anywhere. These samples you will not find anywhere because these are my own samples. I am the examiner of these samples. I am the author of these samples, whatever you can say, okay? So you will not find even I don't give this to any of my students. So you will not find these anywhere. So also the tips, the main thing is how you will do. You can get even these samples, but if you don't do the way I teach, at the end, there will be no improvement. So thank you so much. If anyone wants writing and speaking classes with me, so these are available. These are individual only with me. Okay. Thank you so much. Thank you.